Q1, Q2, Q3 deformulation and equivalence. It is a comparatively might be new topic for the viewers. I welcome all the viewers to this video. Let's understand about the deformulation and equivalence. You might have heard regarding Q1, Q2, Q3 equivalence. I have made some videos on this topic. You can go through those videos to have good understanding. Understanding about the equivalence through deformulation for the Q1, Q2, Q3 is required and is important for the regulatory compliance in the generics. Generic formulations are called as A&D application for the US market. A&D is applied or filed by the applicant to get the approval for the generic drug product in US market. The generic product should be or must be bioequivalent to the reference formulation. Generic product must show bioequivalence to the reference listed drug RLD, or in other words you can say reference standard. Once the bioequivalence is established, then you can say or it is considered that the generic formulation will behave similarly to the reference formulation. There is no need for full clinical studies. FDA generic drug requirements are there. To be approved, generic should have the same active ingredient. The generic formulation should have same dosage form, strength and route of administration, and it should be pharmaceutically and therapeutically equivalent to the reference formulation. It should have comparable quality, safety and efficacy. Q1, Q2 deformulation. Deformulation is an activity or procedure to break down the formulation to understand its composition and the quantity of the excipients. Q1 is qualitative sameness, that means same excipients. Q2 is quantitative sameness, that is the same quantity. The quantity can be considered as similar in the variation range of 5%, required to ensure the pharmaceutical equivalence. Q3 similarity is a physicochemical and structural similarity between the generic product and the reference formulation. The Q3 similarity parameters include pH, rheology, globule size and drug release. And Q3 similarity is required and studies and demonstrated for some complex formulations like some topicals. Pharmaceutical equivalence means same API, same route and strength. Q1, Q2 sameness is required and in vitro data is required. Then coming to the bioequivalence. In vivo study comparing RLD and generic, bioequivalence measures rate and extent of the drug absorption and it is required to prove the therapeutic equivalence. Now come to the therapeutic equivalence. It must be pharmaceutically equivalent plus bioequivalent. That means it will be therapeutically equivalent to the reference formulation. It is indicating that drug will perform the same as the RLD, required for substitution and approval. Coming to the 180-day exclusivity, so just information I am including here. First to file will provide 180-day exclusivity for the generic formulation. First filer with the para 4 certification will get 180-day exclusivity and it will block other ANDAs temporarily for marketing. It helps to promote generic development. So you can have good information and understanding about Q1, Q2, Q3. Then you can easily get the application, and if it is approved, then the generic applicant can get 180-day exclusivity. Q1, Q2, Q3 can be established through deformulation, and it is required to show equivalency. So therapeutic equivalence is the combination of two, bioequivalence and pharmaceutical equivalence. So Q1, Q2, Q3 and deformulation helps in regulatory approval, life cycle management, and it can provide competitive advantage through first to file type of application. This was a generalized information on Q1, Q2, Q3 deformulation and equivalence. I have made other videos also on Q1, Q2 and Q3. I request you to go through those videos to have more understanding. Thank you.